Welcome back. We are back here in the studio. Last time you guys heard from us, we were at the spa having a great weekend getaway. And now we are back to reality, back in the studio with a very special guest.
Yes, so today we have Dr. Kristen Zeising, who we call Dr. Z. She's a San Diego-based clinical psychologist and certified sex therapist specializing in intimacy, desire, and relationship dynamics during midlife transitions, which is perfect for our podcast. She has over 20 years of experience. She's known for her warm, practical, and honest approach to helping women and couples reconnect to themselves and each other. She believes midlife isn't the end of desire. It's the perfect time to rewrite the rules and reclaim your pleasure. So welcome. Thank you so much for coming today. We really appreciate it.
We're so excited to have you.
Yeah.
Thank you so much for having me. I'm excited to talk about this.
So tell us a little bit about you and your background and why do you do this?
Well, so as you mentioned, I've been a psychologist for over 20 years. And, when you first become a psychologist, you learn about a variety of different populations and issues and problems. So that's where I started from. But then over the years, I kind of narrowed down my specialty to be more about just adults and couples. So as I'm working with these adults and couples, I ask all different kinds of questions in the assessment. And one of the questions I would ask about is your sex life. How do you feel about it? And I've noticed that quite a few folks who have been to therapy before said, gosh, I've never been asked this in therapy before. And people aren't really talking about sex out there. And there's a lot of stigma around sex. So I felt like, well, it's an important part of who we are.
Right.
And there's a lot of layers to it as well. So I thought, not only do I appreciate talking about it, I'm comfortable talking about it, I thought, I want to get more education in the sexuality.
How do you get more education in sexuality? I mean, are there classes? Is there, obviously there's a certification.
Yes. So there's this organization called ASECT, the American Association of Sexuality Educators, Counselors, and Therapists.
Oh, wow.
And it's the largest kind of governing body. And basically it's like 150 hours of training, 50 hours of supervision, all different kinds of courses that you take to learn about sexuality. And it's very detailed. It's about the cultural aspects of sexuality. It's about like your family dynamics and how that impacts your sexuality, biology and hormones, relationships. So we cover all of that. So then that is the information I can bring to my clients.
Yeah.
And I found that, because I was comfortable, like I said, I kind of become alive and I get excited. My clients feel like, great, they have a safe space to be able to talk about it and learn and grow. So it's been such a fulfilling and valuable part of my work.
Yeah. Well, good. Okay. So let's get down to some nitty-gritty questions.
Yeah.
So midlife.
Yes.
What challenges do you think the midlife woman comes to with, in addition to sex, being an issue? Because we physically are having a lot of things going on. So, like, sex may not be as comfortable as it used to be. Mm-hmm. So, with that, and also mentally, what does that woman look like when she's coming to in a midlife, in her 40s? And going through all these changes or having perimenopause issues, or it's like anger. I mean, what else is there? There's anger,
Depression,
anxiety, panic attacks, isolation. Like you mentioned, the kids are gone. There's a whole transition there. Then you have to renew your relationship with your husband or spouse, or even if you're single, you're by yourself if the kids are gone. Like, there's so much going on during that time. What is the most common thing that you see women coming to and worrying about or complaining about, or whatever it is that they
needing support with?
Well, they're coming in with all of those things and they're feeling completely overwhelmed because it's a lot to manage. And they're coming in saying, I don't feel like myself anymore. Or who am I right now? And I don't feel grounded and I don't feel clear. And I don't feel like I have a roadmap on how to deal with all of this. And I think, in life, when we have one big issue, we can manage it, or maybe two big issues. But when you have this plate full of all of these challenges that you're facing, it can just feel overwhelming. And then, like you're saying, if you're having some mood issues related to perimenopause or menopause, and you're not feeling as stable and strong, then you don't feel like you can cope with these things as well. So they're really coming in wanting to be able to learn how to cope with these things and get some direction. So we kind of tease it apart and kind of look at what's the most important thing that you're first coming in with that we can tackle, and how to shore you up to feel strong enough to deal with everything else. So sometimes I'll work with psychiatrists so that maybe if they need medication, we'll tackle that part. Sometimes I work with gynecologists to look at the hormonal piece and tackle that part. Sometimes they'll come in individually, and then they'll have maybe need a couples therapist, so we'll focus on that, or I'll work with the couple. But yeah, it's definitely like I want to get clear on who I am, how do I manage all of this in my life, all of these changes.
Yeah.
How do I deal with depression, anxiety, grief
Yes.
that's going on?
What is the difference between menopausal or premenopausal depression and depression not during that time? I mean,
Well, I think you'd have to look for each person, but there can be situational depression that people go through and life changes and life struggles. But I think with perimenopause or menopausal, I mean, there are hormonal changes going on. So that can be an important point. And I think back in the day, it would be like, well, we'll just put you on an antidepressant and hope that that solves everything.
Right.
For some people, it might. But again, when we now have so much more information about hormones,
yeah,
now we realize that can play a huge factor.
yeah,
But also, if you're going through like major changes in your own life and your identity,
yeah,
and like, who am I now? And all of these roles are changing all at once.
Yeah.
That can be a huge burden to try to figure out. So that can cause depression.
Do you feel like, and this is kind of a random question, that I feel like sometimes women might come to a conclusion where like they have done so much for everybody else for
Yes.
so long that now they're, like you said, finding a new them
Yep.
and a new way of going forward. Like, okay, I'm like almost halfway out of this life. So how do I want to live the rest of my life? Do I want to live it with this partner? Do I want to live it and do a complete career change? I mean, I think it's also a brilliant time because we get that like epiphany, but also it's scary. Like that's, we've given so much of our lives to all these people usually, and then now the transition is a hard one. So do you see people struggling with that? Like you said, who are they at this point? Like, and where do they go?
And for a lot of women, being caretakers has been a huge part of their identity if they've had kids. And for some women, just in general, thinking about others. We're nurturing beings, right? So we're always focused on others. So if the kids leave the house, then it's this like kind of emptiness. Who am I? What's my role now? And, how do I take care of myself? That's a big question. It's one thing to say you should take care of yourself now, but it's another thing to go, well, wait, what do I even want? And so many women come in my office going, I don't even know. Maybe I have been focused on my career or my husband or my kids. And now, well, gosh, if I even ask that question, I don't know I have the answer.
Yeah.
And so that's tough. So we really spend a lot of time in giving that space to really explore, like, what could that look like? Because the therapy is about giving you hope that you have this second half to life that you can decide how you want it to look.
Right.
And that can be really empowering to think about that. But you have to kind of get through this kind of difficult part, I think, at first.
Yeah.
It kind of crumbles a little bit, and then you can rebuild.
Yeah. It's like unpacking all the feelings of what got you to that point.
Yeah.
And then deciding, I guess it's just kind of like learning to be you again. Do you feel like that?
Yeah.
I feel like that's how we talk all the time.
Well, and also like just forgetting what brought you joy before,
Yeah.
I mean, this was a few months ago, but somebody asked me like what my hobbies were. And I thought for a really long time, and I said, I like to read sometimes. And yeah, I don't know.
You weren't sure.
I didn't know.
Yeah.
I felt like this is so sad, but I really don't know what my hobbies are. I don't think I really have them. I mean, now I'm trying to get a little bit better, but yeah, I didn't really have hobbies. My whole life was spent either taking care of kids, husband, home, I guess, myself a little bit, but not to the point where I was able to, regurgitate a list of hobbies, for sure.
And also what used to please us or make us happy in our 20s and 30s changes.
Yeah.
Sometimes we hold on, we cling to the past and try to hope that those same things will make us happy. And it's like, no, I don't have the same energy or the same interests. So it's having to be willing to look at that and go, well, let's explore what could make me happy now. What feeds my soul and my spirit? What makes me excited or makes me feel joy? And a lot of times we look at the little things, going for a walk and noticing nature, or having that morning cup of coffee out on your deck with the birds and sinking into that. Or connections can be really important. We'll probably get more into that as we move along today. But these are
That's
really
so
important
true.
pieces.
This morning I woke up and I had to walk out to my car and grab my computer. I left it in there last night, and I was like, oh my God, it's so beautiful out here this morning. And I was listening to the birds, and I saw there's so many birds out there. It was a lot, and I was thinking, God, it's so nice to hear that. It's quiet, and all I hear is nature. It's beautiful, and you're always rushing around, so sometimes you just don't realize there's so much beauty around. So yeah, it's nice to take those moments. But I just think I want to get into the sex part, but what do you think about, what are men complaining about in the sessions when their wives are going through all of these situations?
Yeah, I think.
And how do we work through that? Because that's hard.
I think we need to give some attention to the men during these times as well.
Yeah.
Because first of all, there have been books out now about midlife and perimenopause and menopause, but there haven't been for a long time. So all these changes are going on. They're looking at their partner going, who are you? Like your mood, your attitude. I don't even get a sense of who you are. So they're going through their own disjointed feelings. So I will say, though, oftentimes when they come into my office, it's usually around we're not having an intimate life. Like we want maybe emotionally intimate or sexually intimate. So how do we create that? Because they're frustrated with that for the relationship. And then they also will go through their own kind of midlife challenges with careers. Like, oh, I'm not really satisfied in my career, but I've been this primary caretaker, breadwinner.
Right. I think we don't give that enough credit too, because they've just been grinding and head down in the sand and just going forward to provide. Not everybody and not every household is like that, but a lot. And I think you're right. Like they're just like, okay, well, now what do I do? Also, their kids are gone. And then
they have an angry wife.
Yeah, they have
exactly.
An angry wife. I know my husband has a teenage daughter almost, and me. So, and our old boys are gone. So his best friends are gone, and he's just stuck with these crazy people. And so I feel
hormonal on opposite ends.
Yeah, exactly.
Well, it's
So
like a
that's
second
awful.
it's like a second puberty for us.
Right.
Like we're going, kids can go through it, then we can go through it, and then the partner's going, oh my gosh, what am I going to do with all this? So it can really throw them off as well, and they're going through role changes as well.
Well, and hormonally too, because my husband has said before, he makes a joke, but he says, you're going through menopause, I'm going through menopause. Because he feels like he's having some shifts in his energy, and he likes to relax, he likes quiet, so he kind of feels like I'm going through some hormonal changes too, because I'm sure women's hormones go like this, but men's probably start to do something similar-ish, right, when they're in midlife, I would imagine, either with testosterone or I don't know.
Yeah, absolutely.
Absolutely. Their hormones change. Andropause, we can call it. So, so that's important to just honor as well. It's about being compassionate to each other in a relationship, right? She's going through her challenges, he's going through his challenges. Can we talk about it together and support each other as we're going through that? So that definitely, that's another whole situation that we want to talk about in therapy. And then oftentimes he's coming in with her, though, at this time going, gosh, again, we're not having the sex and intimate life that I want.
Absolutely.
And so that.
But why is it? What is the man's understanding of why he's not getting what he needs intimately?
He'll come in generically, but many men come in saying, I'm wanting it. That's how I feel loved. She doesn't want me anymore. She doesn't love me anymore. She's not attracted to me. And a lot of times, actually, our sexuality isn't about the other person. Sure, there's aspects about the other person, but a lot of times it's just how we're feeling about ourselves, how we're functioning, how we're just feeling in our bodies, how we're dealing with our desires and everything. So he takes it all personally. So what I'll say to him is, look, yes, you need to be heard. What your needs are very important. But they're often pressuring their partner, like, you need to have sex with me. We need to have sex regularly. I want you to do it all these certain ways. And she's feeling pressure, so she pulls back because she's like, pressure is the biggest mood killer.
Right, it is.
So I try to help him, look, you're being heard, your feelings are important, but let's work on helping you settle down and self-soothe at this moment so we can also talk to her about what's going on for you. You know, and again, it's always multi-layered. It's never just one quick and easy,
No.
here's a problem.
Not with a woman.
Well, and if they're on antidepressants, I mean, that can definitely affect sexual drive and desire.
Yep.
So a
it
lot of
depends
them
on
are
that.
on that, and then they feel like less desire as a side effect, right, of the medication, which
And
is
men,
kind of a bummer.
men are on it too, and
Yeah.
the same thing there.
Yeah.
And if the woman is the one has a bigger sex drive, then that's the same thing in opposite roles. But
Yeah.
I think, what do you think about, so how do you, because I think for me, I sometimes try to explain to my husband, like, it's not that I don't want you, desire you, or love you and think you're amazing, but it's because I have so many things going on physically that, and I know he understands and hears me, but what about those husbands that, like, they hear you, but they don't?
Well, we have to work on empathy and attunement and really, really taking it in. I mean, whether it's about this or anything else, it's about really being able to hear your partner and take in their experience and have compassion. And it's also about, let's look at how do we help the couple come together maybe in a new way. So, you know, we talk about, like, it's not going to be the same as it was in the past, but how can you guys come together? And if the female's going, you know what, right now I'm having some sexual pain and intercourse doesn't feel good, which is very common for a lot of women as our bodies change, let's do some lovely sensual touching. Let's do things we call outer course, where it's like touching on the outside, focusing on the whole body is erogenous zone. You know, let's focus on other ways to bring pleasure to each other that might look different and be able to connect that way.
Yeah, that's a good idea.
That is.
Yeah.
And what about dating each other? And I feel like also sometimes, because there's a high divorce rate during this time, men sometimes and women both go outside the marriage to get fulfilled, and that's when divorce happens, or because they're seeking, I guess, validation that the other partner at that time just can't give. So, I mean, maybe they just don't want to deal with it, and then.
Well, I think they're seeking validation that their partner's not giving, because maybe, you know, partner's been raising kids with them and dealing with them for 10 plus years, and it's just, they're not going to give all of that praise all the time.
Yeah.
I think if you're recognizing, hey, I'm missing something, you got to raise that issue to your partner and say, hey, I'm just not feeling connected to you. I don't feel like you really see me. I mean, it takes people to be really evolved to tune into that and actually say it, but it's really important that you can say it and give your partner an opportunity to show up in that way.
But how can we say that? Because there's a certain way. We can't just get in an argument and yell it. They're not going to hear it.
Yeah.
So what's a good way of translating that?
Of saying, hey, I'm not feeling connected to you. I'm not feeling like you see me anymore. And I feel like you take me for granted. You know, to be able to say those kinds of things are important.
Then are we supposed to come with, like, this is how you can, like, are we supposed to say?
Well,
to give them hints.
Well, I think being able to say, this is the way I feel loved. Like, we talk about love languages a lot.
Right.
These are the ways in which I feel appreciated. Like with my partner, I always let him know when he's doing something that I really like. I reinforce it so he knows, oh, first of all, I'm making her happy, which he wants to do. And that I'm letting him know, this is what I want more of. So we can do those kinds of things to try to make more connection in the relationship, whatever it might be, sexually or emotionally. Yeah. But in coming back to just the divorce rate and external validation, we really have to be realistic with relationships. They're not there to prop us up all the time. And though someone externally might just meet you briefly and think you're the cat's meow, but, give them enough time, it's going to end up similar ways.
Same situation.
And so it's kind of an inside job, too. Like, sometimes we'll try to seek outside what we really need to work on that's supposed to be inside. How do I take care of myself and feel good about myself and feel valuable without it being all about somebody else giving me that validation?
So what is practical? I mean, we're in charge of our own happiness.
Yes.
So if that's the case, what is a practical way of having a sexual relationship where they always feel validated by that sexual relationship? I mean, I know there's a give and take, but what's my question? How am I phrasing this the right way? What is reasonable while you're making your own happiness normally and then feeling validated sexually by your partner? I mean, I think men are more sexual. I shouldn't say that. Are men more sexual?
Yeah, I would chime in there for me personally, because I feel like the situation where the woman says, I'm not feeling seen, et cetera, like I've heard that from my husband. So I had to take that information, and I don't think it was it really wasn't sexual. It was more like emotional, right? And so for me, I had to take that and really listen to it. And it took a while for it to actually stick. But I realized that I think he felt I wasn't putting him as a priority over, a high priority. Like, he's my husband, he should be high priority. And I was going through a lot emotionally and all the changes, and it was depressing, and I got tired of feeling bad, and you get tired of always feeling angry and down, and it's so annoyingly tiring, you know? It's really exhausting. And then also the expectation that you carry the mood of your family, right? Because if the mom is in a bad mood, then the dad's in a bad mood, then the kids feel that, and then they're in a bad mood. So there's so much pressure on you to be in the good mood. But so me being on the other side of that, hearing that, it's interesting because I had to be the one to think, okay, what can I do to make him feel like he's a priority? And so for me, I started to prioritize our friendship. And that seemed to make a big difference because he felt like, oh, I'm like her friends. She loves her friends, but she also loves me because now we're really good friends. So, I mean, that's kind of how I attacked that problem. But so I don't think it's just women. I mean, just men who are sexual, because that really wasn't the issue. It was just more of the emotional. Yeah,
we all want to feel valued, like we're important, and that we mean something to our partners. And I think when we're with somebody day to day, we can lose touch of that, and we can get, I guess, a little lazy as far as how we show that, because we're also focusing on ourselves and trying to keep ourselves going, right? And especially at this time,
just thinking,
there's so much to focus on. Oh, and I love you. Yeah, of course I love you.
Right.
But you need to feel that from me. And sometimes it just takes a little extra reaching out, even just
and
during the
that's it
daytime.
right there. You need to feel that from me. That's exactly what you just said is nice, because we do get, it's all mundane, the same kind of thing. You've known them for 25 years or whatever it is, but we do need to make them feel seen. I think that's really important.
But I also feel like for men, it's not that difficult. They respond to little things, and they love it if you, if I make a dinner and then I actually serve it on the plate to my husband, he's like, wow, this is amazing. It's a small thing. So I kind of feel like in that way it's nice, because I think women were a little bit more complicated. How are you feeling? I'm fine. they're not really fine. You know, men are like, yeah, I'm not having a good day. You know, they're just like straightforward. So I do feel like it's little things that work better for them. Whereas I think women, we're just, it's more nuanced, like what's going to make us, because we don't even know what's going to make us feel better. We don't know.
So true.
Right?
Oh my gosh.
A lot of times we don't. And I think it's about getting to know your partner, like thinking about, what do I know makes them feel loved or special or thought of? So just reaching out during the day, like I was saying, or serving a certain, the platter, the plate. I mean, just knowing your partner that would make a difference to him and doing it.
Right.
Again, it doesn't take a lot,
Yeah,
right?
it doesn't. It's the little things, right?
It's really the little things. And as far as being sexual, you were bringing up, men being more sexual or women. And
I think specifically in this time of life, because there's physiological things going on with a woman, that's why it's like, how can we make that partner feel seen and heard and sexual when your body is like rejecting your sexuality at that point in life? That's, I think, a hard piece, because if physical touch and connection is how they feel loved, and you can't because you're just not in that physical spot, then that's where it becomes difficult, I think. It's a challenge.
Well, especially when it's a physiological thing for the woman.
Right.
I also find that many women have been maybe having the same sex forever.
Like the same type, like
Kind
missionary,
of,
like the same type.
Same routine. We kind of get in these routines.
So they're bored of it.
They're bored.
Spice
So
it
many
up.
women get bored, and I just don't think that there's a lot of conversation around that, that we really like novelty.
Yeah.
We just get into that, okay, again, I'm tired, long day, okay, fine, I want to make you happy, and so we'll do it, but it's not
But they're
from a
not
place
into
of-
it.
Yeah.
And
not
the men
into
can
it.
feel that
Yeah,
too.
absolutely.
A lot of men talk about they don't like the duty sex. They want
Of
to feel like
course
their
not.
partner wants to be into it. Then the partner's going, well, I'm not that into it with you, so I'm not going to fake it. And so they get in this stalemate. You know? So that's why we want to look at shifting it up and what are the different ways you can be creative and be sexual.
What are those ways?
Well, that's why we start talking about, okay, well, let's look at the sensual pieces. Like, I'll work with couples on doing these sensual touching exercises where they can start tuning in to all of their senses. We'll have them, like, start touching from, like, head to toe and feeling the touch all over their body, and kind of recording in their mind, ooh, what area felt really nice to feel touched, and what kind of touch felt good. And you can bring in little feathers or things like that, to practice with touch. You can talk about even, time of day. I mean, I have so many couples talk about the different time of day that don't work.
Totally. It's not aligned.
Yes, and that can be aligned. So, like, how do we working through that? For a lot of couples that, have kids, it's like, okay, can you get like a sitter or, get out for one night? Just sometimes, we had a couple recently that said they were so surprised just going to a hotel room for one night totally invigorated them.
Yeah.
And you hear about this, but really when you're in that same setting every day,
Right.
and it comes with routines and structure and chores, your brain associates that with like sex, and that's not a good pairing.
It's like another chore.
Absolutely.
Check. Got that done.
So you get out to this nice hotel that's nice sheets and sexy atmosphere, and then that other part of you can sometimes come out.
Yeah, there's no distraction.
Well, and because you don't feel like, mom/wife, you're like, oh, I'm like a girlfriend again, and that's a really cool feeling.
And I really help women get back in touch with their sensuality, because after all of these years of being mom or career woman and wife, and kind of they can lose themselves a little bit, and then with the hormones and everything changing, it's like there's not that same oomph, that push to be really sexual. So these little things of like, maybe you take a nice shower and put a nice smelly vanilla lotion on, and it can invigorate the senses that way. Or find some lingerie that suits you now, that feels soft and satiny, that you can see yourself in the mirror and kind of go, ooh, that looks sexy on me. Or get your hair done, or tend to yourself in a nice way that can help you feel more connected to your body again.
Yeah.
These are just some of the things we look at.
So a lot of these that you mentioned take money. Going to a hotel takes money.
Yeah, that's true.
Getting new pajamas, getting your hair done.
Yeah.
And maybe some people can't afford that, and they still want to have a sensual, non-chore-like sex life. So what do we do then?
Well, so that sensual touching exercise can be lovely. Because again, that takes you away from the performance sex of
Right.
here's how we start, and we middle, and the finish. It's just about
Same
touching.
old. You know what to expect every single time.
Well, and then also, what's great is now there's a lot of apps. Okay, those do cost some money, or books you can read. I also have this little checklist that's like a yes, no, and maybe checklist. Like you can go through and all these different sexual activities. I'm like, okay, yes, we know we like that. And then these, well, that's no for me. I'm never doing that. Then there's the maybe of, well, maybe I can try that once and see how it goes. So you can bring that kind of new experience.
So are we talking about things like toys?
Oh gosh, toys are great.
Toys are great. Okay, what about, I don't know if this is for everyone, what about pornography?
Yeah, that's one of those things. Some people are comfortable with it and sharing it with their partner. Some people are uncomfortable with it. So it's all about, I guess, your own value system around that.
Yeah,
But that
that's
can
true.
spice things up. I mean, there's different kinds of porn.
Yeah, I was just going to say that because there's like girl porn,
Yeah.
which is like, 50 Shades of Grey, 365 Days.
Oh
you
my
know.
gosh. Speaking of that, have you watched that?
No, I have not, but I've watched 50 Shades, obviously.
Well, I have
multiple times.
watched 365
Is
Days.
it like
because
girl
I
porn?
love my sexy shows.
Yes, so do
Sex
I.
Life
Yeah, I love that show too.
and 365 Days. I like Sex Life better, but 365 Days. I don't. My jaw doesn't drop too much, but I was just like, oh my goodness, they are just all the time, constantly. Can't get enough of each other.
That's really funny.
So
I notice a
it's
lot of
very
women-
erotic.
I've seen it, and believe me, I'm on the same page.
Yeah.
And a lot of women also like books, and there's these audiobooks now that you can hear with like the sexy voice saying things. So
yeah.
that can help spice
Like
it
a
up.
romance?
Yeah. But
Kind of like 50 Shades of Grey.
Yeah.
Is
but
it like
more.
a certain genre? Like how would you
you
find
can
it?
there's different apps for it. So
Oh, okay.
I think Dipsea is one of them.
And what's it called? Like sexy romance?
It's like
novels?
well, it's
Or sexy audios?
That's I don't have the exact title, but I know that there's audiobooks,
Okay.
romance novels that you can listen to. I know Dipsea is one of them.
Okay.
And so it can help you get aroused. For a lot of women, they find that I have a hard time getting aroused the same way I used to. Or I don't, the things I used to do don't work. And I'm just having a hard time now. So they'll listen to some of these audiobooks or do some reading themselves because then they get this visual imagery in the romantic part. Or we'll talk about self-pleasuring. I often give that exercise as well to my ladies about like getting in touch. Like again, since our bodies change, our sensitivity can change, our nerves change, and what feels good in our bodies now is very different potentially than what it used to feel good. So spend some time doing some like self-touching and just explore yourself and see, what areas, what kind of touch with lube or with not, fast or slow.
Yeah.
So then you can then bring that to your partner.
Yeah.
And it's also a way of warming up. If you're like, I want to get in the mood, I'm just going to maybe go in the shower and touch myself a little bit to kind of get my body warmed up.
That's great. I was just you just reminded me, I was listening to a podcast and they said 70% of women do not have an orgasm with penetration.
Yes.
70%.
Yep. They often need clitoral stimulation.
Yes, that's crazy because maybe men don't realize that either. And maybe women don't realize that. Like something's wrong with me. No, you're normal. That's normal.
One of the number one things women say to me is like, something's wrong with me or I'm broken. And especially at this time, because things just aren't working the same, so I must be broken. Versus, no, you're just shifting.
Yep.
What you need now is different. So you can have a different attitude around that, one of exploration and curiosity and what feels good. Oh, it's such a different world.
Yeah.
Versus, I'm not like my partner. He comes so quickly. And, I should, be as excited as him. And I'm like, no, men kind of boil quickly.
Right.
Women kind of simmer and slowly get to a boil. They say it's like 20 minutes or so for women to become fully aroused, like physiologically aroused and engorged and lubricated in their mind. So give yourself that time and tell your partner, hey, by the way, this is what I'm going to need. So let's, spend that time getting me warmed up so we can have a good time.
Yeah. So it's going to be 20 minutes. At least 20 minutes.
Yeah, well, because they're usually ready to go right away.
Yeah.
But yeah.
And so many women put the pressure on themselves to be right there, and then may have sex before their body is actually ready. So therefore, that could cause
especially
pain.
in midlife.
Yeah.
Yeah, we do take a little longer to get
Well, and
there.
probably resentment too, right? Because you're just kind of doing it and you're doing another thing for them instead of, being like, hey, I'm just not there yet. Let's do some foreplay or watch some 365 days together,
Or babe, what was that? Pretty babe, no.
Oh, Baby Girl?
Baby Girl.
With
Did you watch that
Nicole
one with
Kidman?
Nicole Kidman?
That was great.
Oh my goodness. Yes.
Yeah, it was great.
I
that
liked
was
it.
fantastic.
Yeah, I thought she did an amazing job in that movie.
Yes.
Yeah,
And
very
dang, she
sexual.
looks good. What the heck? She looks amazing. And I loved the lead. Oh my gosh. I was like Googling him. He was so cute.
It was, but that, again, you need a little something, just put that on.
Well, and like so much of it too is like fantasy. Like men do the same thing. They fantasize and we fantasize too. And I think sometimes they don't realize that, yeah, we have fantasies. Like we're just like you, right? Like we have that too. So, let's try and, make it happen both ways and reenact fantasies. It's kind of fun.
Yeah. So if you allow yourself to have them, and again, a lot of women come in with shame, or there's this stigma around sex, or with some women who've been raised with a particularly religious background, they'll carry that into their relationship, and I'm not supposed to be sexual, and it's not okay, and trying to give them permission to look at this for themselves, and like, what?
How hard is that? Because that is hard. Culturally, they have been taught to not have pleasure, or it's not about them, or like it's almost looked down upon if they did. And I always say, it's cultural is great, but it's 2025. We need to like let women just be and have desire and orgasms and everything. Mm-hmm. But that's hard when it's cultural.
Yeah, because it's been so ingrained,
Yeah.
Or for some women, they believe, okay, when I get married, I'm allowed to have sex, and that's a good thing. So they kind of expect some like light switch to flip on, and it often doesn't, because you've had these messages for so long.
Yeah.
It's like, so how do I respect my religious background, but also respect that I'm a sexual being?
Right.
So we have to work on that and kind of change some of the inner dialogue and messaging around that, and help them embrace their body for what it's here for. It's like, it's interesting how sexuality can just be kind of cut off. It's like, okay, you can be a human being, but that part is so taboo. Or
Right.
it's like, no, that's you have a clitoris for one reason and one reason only. It's pleasure.
Yeah.
So helping women get in touch with that.
What if the gentleman does not, or partner, anyone, whoever they're with, is not an oral, like, stimulator?
Oral stimulator. Yes, a lot of women do.
Is that what I'm trying to say? What is the proper term?
Oral sex?
Yeah, what if they're not into
Or
it?
pleasure?
Yeah.
Yeah. Well, so you're discussing that because you're talking about the clitoris, but of course you can use manual stimulation. You can use a hand, especially with a lot of lubrication.
Yeah,
that
but
can
it's
be
not
really
as
nice.
good.
Oral sex is fantastic. There's also vibrators.
Yes. Yeah.
And I would, if a heterosexual couple come into my office and she says, I really want oral sex, I like it so much, and he goes, I don't like giving oral sex, we'd unpack that a little bit, like, well, what is that about? Is it, I don't know how to do it, I don't feel like, how do we do this thing? Is it, there's a certain sense, smell, texture that's uncomfortable? Does it mean like there's a hygiene issue? Or, because women smell naturally lovely, but there could be other things going on. What is that about for you? And then we kind of see if there's anything we can work with in that way. But yeah, people do have sexual differences and different things that they like, and that can be a challenge for couples.
Well, and it can go both ways too, right?
Absolutely.
Sometimes men like that, and the woman's like, I have a gag reflex, or whatever,
Right.
Well, if she has a gag reflex, then we can teach her about how to use your hand as well. So you're not trying to put the whole penis in your mouth the whole time.
Right.
That you can actually, there's techniques so that you aren't gagging so much.
Yeah.
But I think it can go deeper than that too.
So as a sex therapist, are you teaching that?
Yes.
Okay.
That's amazing.
Yes. It runs a gamut. It's like there's the parts of like trauma and the cultural things and sense of self and all of that, family dynamics and passed down shame. But then we can also talk about kind of like the fun stuff as far as what are some ways to enhance your sex life,
Yeah.
new things you can try,
Yeah.
techniques that aren't working that can help you learn how to do differently.
So lubricants,
Yes.
there's many lubricants out there. Some people have been saying you can use coconut oil. And we also have been working with a wonderful brand, W for Her, and they have a personal lubricant as well. And then there's KY, you know, the ones that you can get at the drugstore. What is best?
They have flavored ones too.
Yeah, I mean, and there's some that warm up. There's like what is good for a woman in midlife who's going to be drier than when she was younger. What is best for that situation?
Well, I think you have to look at the pH, you know, be cautious about that. I mean, water-based lubricants are usually kind of the safest.
Are they silicone?
No, it's water-based.
Water-based.
It's separate from silicone. There are hybrids too. There's a variety of different kinds.
Yeah.
But they can dry out a little bit more, so you can use some spit or water to kind of reactivate them.
Okay.
You know, and there's thicker lubricants if one wants to engage in some anal pleasure. Usually people want more thicker lubricants.
Right.
And there's like
That
more,
makes sense.
yeah. Then there's there's a variety now. Again, some more like friendly to the vaginal bacteria or the pH in the in the vagina. So there's definitely a lot out there, and I found that you can also go to some like sex stores that you can get little samples and try them out and see kind of what you like.
Yeah. Because there's so many out there. You just
Yeah.
don't know. And the pH is important because you don't want to cause another issue.
Yeah.
Then you don't want to have sex.
Yeah. I mean, coconut oil, from what I know, it's lubricating, but I think you don't necessarily want it like inside of your vagina and staying in there. I think it can break down and may not be the best. So,
So you're saying water-based is probably...
for most people.
Yeah. Okay. What are some other exciting tips and tricks for, I mean, anything? Is it position? What's the best position? What?
Well, it's about, first of all, listening to your body and what it wants, because people have a variety of bodies, right? So position-wise, I mean, some people love missionary because it just hits them well on the inside. Some people might like doggy style, but you know, if a male partner has a longer penis, it could hit your cervix and hurt. You know, I often talk to women about, you know, listening again to what their body needs, because different positions can sometimes hurt, and then they think, well, sex hurts. It's like, no, sex should not hurt. I educate that a lot.
Right.
A lot of women just grin and bear it.
Right.
And so, no, finding positions that feel comfortable to you. For some women, using there are these special like pillows that are like angled, kind of like a big triangle. Where if a woman's laying down and her pelvis is raised up, and the man is kneeling at the base of it and coming. I'm using my hands, but if it makes sense.
We can see her, but you can't. As the audience can't.
But like then his penis can hit her G-spot a bit better.
Oh.
So find different ways to angle so you can have.
Is it like a sex cushion?
Yeah. And that's the thing. It's like so many women may not orgasm from intercourse alone, but there's some beautiful angles and spots in there that if you spend some time and try different kinds of ways of doing intercourse, like the way I think a lot of boys and men start having sex is like just kind of like jamming it in and in and out, and pound, right?
Yeah.
And some women like that, but a lot of women don't. I find for a lot of women, if there's like a grind, if the man's inside and then kind of grinding around, he might grind on the outside of her vulva, her labia, and her clitoris, and then produce some nice sensations there. Also on the inside, might hit different spots on the inside of the vagina that can be arousing. So just changing that technique.
Yeah.
You know?
Do you have a book?
You
should write a book.
I'm thinking of it.
Of all of that.
Yeah.
So you take it home, we like, let's try this one.
Yeah.
Checklist. I got that. I think that's a good idea, because sometimes, I mean, these are all great tips on just to bring some excitement, make some changes, like be excited to try new things, because we need to connect a little bit differently, I think, as we age with partners. Like you said, it's not the same as it used to be. And
Well, also, I'm noticing for some women, they've had some fantasies and things they've wanted to do, but maybe now they finally have the guts to bring them up because they're looking at, okay, my relationship is stale
Yeah.
and it's not going down a good path. Maybe it's like, what have I got to lose? Actually, I've kind of been interested in kink. Can we try some of that? And so people trying that and just shifting even just the power dynamics between the two, you know, a little dominant, a little submissive, that can bring a lot of new energy. So, or even just putting like on a blindfold and playing with that. I mean, it doesn't have to be dramatic, big things you change in order kind of to rekindle your sex life a little bit.
I think 50 Shades of Grey years ago
Yeah,
brought
it
on
totally did.
that, like, okay to start doing those things in relationships too,
Yeah.
which was nice. We need more of those types of authors because it really did. I think it just lit a fire under so many
it
women.
put it more into like because a lot of the times it's like, oh, the man likes this and likes that, but with 50 Shades it was like, no, she really liked it too.
Yeah.
And so then I think it opened the door for women to feel more comfortable saying, yeah, that does sound kind of interesting. I would be down to try that. Why not?
It gave women permission.
Right.
And they got excited. And I remember seeing some women talking about it and their partners going, wow, she's all turned on now.
Yeah.
Like, what's going on here? But they liked it. They're like,
Yeah.
read that book some more.
Right.
You know?
I
So-
had a friend
yeah.
that would read it to get turned on so
Yeah.
that she could, you know.
Absolutely. Whatever it takes.
Yeah, exactly. Whatever it takes.
You know, our
And it is
minds.
arousing. I mean, it's fun to read. I mean, I enjoy it too. It's funny sometimes when I see like a good sex scene, I'll be like, I gotta rewind that, and watch that again. That was too fast. Let me do it again.
It's in slow mo. Can we play it in slow mo?
Because and also the build up is fun. I think with girl porn, there's usually like a storyline.
Yeah.
It's not just like they walk into a room and they're getting it on. It's like there's some sort of attraction and it builds and it's like a slow what's it called, long game. It doesn't happen right away. And so with that build and that tension, it just makes for a great you know, love scene, you know, whereas I think man porn is different, you know. It's all about the wham bam.
It really is. I think many men are quite visual and just
They're
seeing
very
it.
visual, yeah.
So that's easy for them to get aroused. For a lot
Mm-hmm.
of women, it's like, well, I can see she's really not that into that.
Totally.
And it's like, that's just so fake, and it just doesn't work the same way. So that
doesn't,
tension,
yeah. Mm-hmm.
like you said, you know, our mind is our biggest sexual organ. So sometimes just the fantasies and the
Right.
ideas and the game and the play and the flirt and the back and forth, that kind of dance can be really nice.
Yeah.
So instill a little bit of like flirting in your day.
Yeah.
A little bit of sexy comments. You know, that can be really nice.
A little grab ass here and there. Yeah.
Yeah.
I have a question here, but it's kind of going off to a different. Do you think that women talk about sex to each other when, like, friendship wise?
Great question. So I've talked to some of my clients about this. It seems for some women, like I have a client and she and her girlfriends get together and talk about sex and talk about books regarding sex and learn a lot from each other. And then I know people who say, oh my gosh, I would never talk to my girlfriend about it. So I think it depends. It's a mixed
Yeah.
bag. But I think it's so helpful when you do, because we're all, or any kind of challenge you're having to share with other women, we're such a great source of knowledge.
Right.
You know, it's like you might share something. I'm having this challenge with my husband sexually. Oh, here's an idea. Here's what I do with mine, which is helpful. But also to feel like you're not alone.
Yeah.
You know, and that you're not broken, and that you can get support from someone. And just sometimes just getting it off your chest and talking about it just feels supportive. And there's no answer, but just in sharing.
Yeah.
Yeah, to feel heard.
Yeah, I don't know. I think my husband and I were driving home from some vacation, and I was on Instagram, unfortunately, and something came up, and it said something about the average time you would have sex in a year or something, and I told him that, and he was like, "Oh, well, we need to step up our game or something." And then I kind of thought, "Oh my God, I'm so offended," and then I thought, "Wait a minute." Who's to say what is healthy in a relationship? You know, I'm like, so is it healthy to have sex once a week, once a day, 30 times a month? Like, is there a statistic that says that it's healthy, or is it just per couple?
another great point, because people will come in all the time and saying, oh, we're supposed to have sex X amount of times a week and we're not. And that's their evidence to kind of pressure their partner to do it. And no, there is no magical amount. Now, we kind of say in the field, I think it's like less than 10 times a year you're considered in a sexless marriage. I don't know what that was based on. That was a number I had heard. It's really about the couple and what feels right for you. Because really, for some couples, like once a week is great. For some couples, they want it 3 times a week. For some couples, it's once a month at that phase in their life. Like I have couples have babies, little ones, and they have 2 jobs. And for them, no, it's just not happening.
Right.
But it's about what feels good for both of you. And I'll tell you, I don't know any couple where both people want sex the exact amount.
Yeah.
It's never. There's always one person wants a little bit more or a little bit less. I will say one caveat, though. It's kind of that sense of also knowing it's going to happen is important. I think when couples feel like, I don't know when we're going to have sex again. And
so scheduling it?
Well, it's not necessarily scheduling, but just having some kind of flow.
Yeah.
Some kind of sense, like it doesn't have to be scheduled, but just that sense of, we'll get to it. And if we didn't get to it this week or next week, but we know it's part of our lives and it'll happen. Some people do like scheduling, though.
Yeah. Yeah.
And need to schedule. I also find that when I have a big discrepancy as far as sexual amount, desire, say stereotypically the man wants more and the woman doesn't, if we schedule, then he feels like, at least I know I'm getting it.
Yeah.
And then she feels like, at least I know I'm not being pressured every day to have sex. So that can happen.
Yeah. I can see how that would work.
Yeah.
Because it alleviates the pressure from her, and then he also feels like I don't have to bug her because I know it'll happen Thursday night or whatever.
Or with really, really busy schedules and kids and life, gets away from you, and it's like, oh, wow, we haven't connected this way. Let's put it on our calendar for Sunday, And then you can think about it. You can think, how do I want to step into that arena? How do I want to make that happen? Instead of seeing it as, great, we've scheduled sex and then we got to do it. And how am I going to be in the mood? Well, you can create ways to get yourself in the mood, like we were talking about with books or self-touch or
you can plan it out where you get candles and music and wear something sexy.
And again, I want to say this for the listeners because I think this is really important. When you're in midlife, you could have desire problems and libido issues. So it's important, as you said earlier, to go and work with your, hormone specialist or whoever it is to make sure that your testosterone is good, your estrogen is good, your progesterone, everything is functioning at the top of its peak, because it can cause a real problem if someone has no desire and they're never going to get there. It's just they can't get there. So I think it's important. That actually might be something to talk about, because what happens when that part of the marriage, when the woman is in midlife and nothing is working there.
Yeah, that could be a real big challenge for both of them, really stressful.
Yeah.
And I'm glad you're bringing that up again, because I always talk to my clients about, have you gotten a medical workup, and really looking at that, because there are options for you.
Right.
And if your hormones are really off, then that you can try to do all the things you can, but it might be hard to get your body going.
And they most likely are. If you're in the age of 40 to 60, they probably are.
Yeah.
So if you get that figured out and then they start doing all these things, amazing. That could be the best time of sex in their lives.
It could be.
Yeah.
And we do look at, okay, how is the relationship? We do a relationship autopsy. Are we feeling connected? Are we feeling respected? Are we feeling like we're, nurturing each other? Do we need to put some attention back into that? I think there can be those pieces that are impacting the desire. There can be chronic illness or medical problems that come up, especially in midlife. That's as we get older, we're more likely to have some of those issues. Yeah. So making sure we're addressing that, because that impacts it.
Yeah.
We can have also aging parents, that we're caretaking now. So now all of a sudden we have that role.
Yeah.
We can have the career stuff. I mean, there's a lot of things that can impact a woman's sense of sexuality and desire.
Right.
So really important to look at all of those things and address them all, and then see what we can shift. And then, again, this is a new chapter where we have a lot of possibilities in how we want to live it.
Yeah.
I think the old messaging is like, yeah, sex is for the young, you get older and old crone, and like you're not going to be vibrant and sexual. I can't tell you, I've had couples in my office in their 70s having great sex. Now, I mean, that's something in my mind I want to aspire to. It's like, how are they doing that?
At what age are you actually like, just, is there an age? Can you have sex until you're like 100?
Well, I think it's about defining what sex is for you. Because we have a kind of, when we say sex, I think we all have an image, or not an image, but an idea of intercourse.
Right.
But sex can be a whole menu. And when we can expand that, that's when, yes, we can have sex till the day we die.
Yeah. Yeah.
Oh, I love that.
Right?
The menu.
Yes.
That could be your book.
That's the sex menu.
Sex menu.
No, just the menu.
The menu.
It's ambiguous.
I like it. Thanks for the idea.
Okay, so I'm going to go a little dark. When do you, because you do couples therapy, at what point is there a point that the relationship, you just look at the two of them and you say, let's make this therapy session about how to get divorced?
So,
And does that happen?
I believe my job isn't to tell them whether they should stay together or get divorced. That's a big decision. That's for them to make. However, I will help them reflect on how they're showing up in the relationship, and are they living with an integrity and like how they want to live in a relationship, and how they're showing up, and to self-confront, like to be able to ask themselves, am I really getting my needs met? Have I done all that I can and it's still not the right fit? I want them to be asking themselves those questions and to be able to come up with that answer for themselves. Because if I were to tell them, okay, it's time for you to get divorced, even if they feel like it is, what if they decide it wasn't? And then they, my therapist told me to get divorced.
Yeah.
So just from that angle, I always like to make sure that they're looking at asking themselves, and I'm asking them these questions to help them really take a look at how they're living, how they're creating this relationship, and is it really for them?
Yeah.
And if they've been trying and it's not getting anywhere, we can talk about that in therapy. Like, gosh, you guys have tried this and tried that. What are you seeing here? Help ask those questions to help them look at that. And then if they've decided, yeah, this isn't getting anywhere, then yeah, we do talk about them. How do we divorce amicably?
Yeah.
And consider if there's kids involved, how to be respectful, kind of like that conscious uncoupling.
Yeah.
And
Yeah. I bring that up because I also know that during midlife, it's very empowering for women. And they do realize that they're not in the situation that they want to be, and that they can change and have a whole different life. So it's almost like giving them permission to seek out some help and maybe unpack that situation and give them the power to leave a situation that no longer serves them anymore, or it's even like the same as like the workplace. If you're in a job that you've been in for 20, 30 years and it's awful, giving them the permission to leave that, or finding a plan to do that. So I bring that up because I wonder, do you see that often with women in this age group, just because they're learning what they do want, what they do like, and they aren't getting it where they are in that relationship, and then they feel empowered to be different and like be the best version of themselves. And sometimes it's not with that current partner.
Yeah. Usually they'll come in alone and say, I'm not satisfied, this doesn't feel really good, but maybe I'm kind of scared. I've been with this person for a long time.
It's very scary, I can imagine.
Absolutely. It's terrifying for a lot of women. But like you're saying, they're kind of coming into their own. They're like, I now know myself more. I know what I want. I feel like I've tackled a lot of things in life. I can tackle anything. And I I want to live a fulfilling life. And they also see, oh, life is kind of half over. So it's not like when you're younger, you're like, oh, I have all these dreams and possibilities I can live into. Now it's like, oh, if I don't make these changes now, I don't have a ton of time.
Right.
So, I feel this urgency to really make it really good.
Yeah.
And so that's when they're looking at, hey, this partner, either it's our values have shifted, or what we want out of the relationship has shifted, or it's gone dry in a way that I just can't reinvigorate it. And it's time to look at, starting a new life for myself. But I see some women thrive. Oh my goodness, when they're letting go of what doesn't serve them anymore, whether it's relationships or jobs or even friendships, when they now are like, you know what, I can say no. I don't have to do this anymore. When they realize that, and they start living a life that's like by design, the one that they want, it's so exciting.
Yeah.
And then they're like, I don't need all of that. Like I can do what I want. I don't have to do what everybody else is telling me to do.
Right.
Or again, stay in things that aren't serving me.
Yeah. And that's huge, because that's why we have the podcast, to talk about our feelings and what we're going through. But also, like, this is the time to do you. Take care of you. You're done raising everybody. You're done giving yourself. Like, of course we still do that, but it's time to like look inward and really make sure that the rest of your life is what you want to be doing, because we get one life too. It's not for we don't have to make sure everyone else's lives are great. We got to make sure our life is great. At the end of the day, I want to look back and be like, I did this because I really wanted to do that, and I've fulfilled every single tiny dream that I ever had, because I think that's so important.
And nobody's gonna do it for you.
Right.
That's the other thing.
Oh, for sure.
Yeah, and it's like we can all relate to that. There's something about this age you realize, like, again, maybe the fantasy when you're younger, some white knight is going to come save me, or marriage will do this for me, or that. You realize, no, you are the one who's going to create this best life for you.
Yeah.
And let's do it now. And you may have more resources now, like you might have more financial resources, you're smarter and you've lived life.
So much wisdom.
It's like, you can do this.
Yeah. And when they come to you looking for themselves again, they find themselves.
Yes.
And then they're like, this is who I am now, and this is what I want. And I think sometimes, because it is a big transition, and men are seeing, our spouses are seeing that transition. So a lot of times they're either on board or they're not, and that's, they have the choice to be on board or not too. But like, are the women supposed to sacrifice the rest of their life to make that relationship work? I wonder.
I don't believe anybody should sacrifice themselves to make a relationship work, because then it's really not working if you're sacrificing yourself. Sure, there's times when you have to put aside some of your own needs if you're, raising kids, and like they require more attention for things like that. But ultimately, we are here to live a full, happy, and healthy life, because when we do that, that spills over into our other relationships, into our marriage and our parenting and our community. So I think with partners, yes, I think some can be threatened when a woman steps into her full power, because boy, is she fierce and she's strong and she's vibrant and sensual. Like, all of that can be hers if she just takes it on and owns it. And for some men, it's very threatening. Maybe they've been the one who's more dominant in the relationship or has more control or say, and so that can be challenging. And maybe she realizes again, like, maybe I don't really need you like I thought I needed you, or want you around the way I thought I wanted you around, and that's okay if that's her course. But I think for the men who go, wow, I'm seeing my woman step into her power, good for her.
Yeah, that's exciting.
And that's sexy.
Yes.
Because when a woman, it's, as we are getting older, of course, we get our wrinkles, our bodies change. It's not about being that size 4 or perfectly unwrinkled skin. It's about the confidence is the sexy part.
Yeah.
And so we step into that and do what we want, and the joy and the vibrancy that comes from that, that's sexy. And I think when a partner can see that, if he can embrace that and support that, he gets all that to be with him.
Yeah, but I think it does take therapy for that situation to work sometimes, because in my own personal, like, I've grown so much, and my husband's awesome because he's empowered by my success. So he loves it. He's like, I want to sit at home and you go and do everything. So the role switch. So I'm lucky in that way, but I think a lot of women aren't, and it's really hard to have to leave that something that they've known for so long to be able to make themselves happy. But I did just hear that, what is it? Single women are the happiest women.
Yep.
And live longer. And married men are the happiest and they live longer.
Isn't that funny? Like, how does that work?
Well,
because we don't take care of
No,
them.
I'm saying, like,
Single.
how does the statistic work? Like,
Oh, I don't know.
logically.
It's probably an
Do you know what I
Instagram
mean?
statistic, but still.
I saw that too.
Yeah.
The way my hypothesis is that when, again, this is stereotypically or traditionally, there's all different kinds of families, but when a woman gets in a relationship, she's often the caretaker, caregiver, so men often benefit from that.
Right.
Oh, yeah. Big time.
Yeah, and when women though are single and they're younger and like getting into their career and they have their friendships and they can maybe travel or they can do their hobbies, they're
completely
totally
fulfilled.
fulfilled. Absolutely.
Yeah.
So I see a lot of women that in midlife get divorced and kind of live a little bit like that again.
Yeah.
Like, I'm going to go on a trip with my girlfriends, or we're going to have our brunches together.
They start going to the gym and they start doing things that they just didn't have time for before.
Yeah.
And they're choosing themselves. Like,
Yeah.
I'm going to join a hiking group and meet new people. And some women think, oh, will I be able to meet new friends at this stage? And absolutely, people are thirsting for connection. And sometimes it just takes a little bit of reaching out to reinvigorate friendships or join new groups to make new friendships. So if you can get your community of wonderful women who support you, if you can financially take care of yourself, and if you're doing hobbies and activities that you love, that's
What
not
else
so
is
bad.
Sex.
Yeah. So sex.
And a connection with love, being in love
yeah.
maybe, and being...
Absolutely.
That connection is important
Yeah.
too. But that comes with a lot. That's probably why single women are happy.
Yeah. Well, and they have the wisdom too. So, like, if they are making new friendships, they know the red flags. They know, like, who's probably, I don't know, that might not vibe well with me. I'm not going to go down that road, or, you know what I mean? So they make better choices.
Yeah.
I will say that the wisdom that comes from experience in that case is really valuable. Like, to know yourself and what you like more so. And I think women are just like, don't want to put up with BS.
Right.
Midlife and on. It's like, oh, I don't have to. Before, I guess I'll be the good girl.
Yeah,
I'll
people
be nice.
pleasing.
And people pleasing. Now it's like, nope, don't like it.
Yeah.
Moving on. Doesn't serve me.
Same.
Ah.
Yeah. I mean,
Yeah.
even with friendships, like, I don't have tons of friends anymore. I have like a really close little few of them that I could probably count on my hand, and I feel so much better because I'm not trying to... I just want the people that I can be real raw with and honest and have deep conversations and like know the truth is going back and forth, and I feel secure, and I just don't need the fluff like that.
Well, it also takes time, like your friendships, obviously they're beautiful, right? But it's another thing that takes time. So if you're going to take time out of your day, you want to spend that with people who you love and people who like make you feel good and you make them feel good, instead of it being like with somebody who says something snarky or is maybe like rude or says something that hurts your feelings, you know what I mean?
Or just doesn't show up for you anymore. Like, I've got friendships that have been long time, and sometimes I'm like, you just don't show up for me the way that I want anymore, and so it's a different kind of friendship.
Well, yeah, and I've heard some statistics around friendships can last like 7 years, and you can kind of
I just saw that statistic too. It's
yeah.
like, it's okay to shift and
Yeah.
change.
Yeah.
Yeah.
I mean,
Well, in your time of life too, like sometimes you have friends when you're, with little kids, you had playgroup friends and stuff, and then as you grow, you're like,
Yeah.
we were friends because of our kids, or we were friends because of this, you know?
it's okay, again, giving yourself permission to be able to let go of relationships that maybe aren't serving you or best for you anymore, that's okay. Because I think for women, we have a hard time breaking up with friends.
Yeah.
It's like, how do we do that? Sometimes we'll hold on too long because, well, how do I tell her I don't want to be your friend anymore?
Because we feel bad. We want to people please again. Yeah. But as you get older, that gets less and less.
Exactly.
That's
so
like
it's good
one
to
of the
let
good
go.
things. Yeah, you can just say, no, thank you. Okay, is there anything that we did not talk about that you would love to address?
more sex.
More sex.
I just, it's one of those things I can talk about. I think we're
Sex.
Just I think the piece.
Pleasure. If you had to give your advice, the best advice on sex and having the best sex life with a trusting partner, you're in a good space and your relationship is strong, what, just to make it just that much more exciting? Try new positions.
It's more of when they've done studies about what makes the best sex. It's not like a position thing. It's a sense. It's an energy. It's a flow. You know that sense when you're in the flow of something, you're just so immersed, you're not thinking about other things.
Yeah.
You're not evaluating, you're not judging. You want to get to that flow place. So I would think
Connection. So it's just...
it's a connection, and it's an ease, and it's a back and forth, and it's like a dance, and you're just in it. So mindfulness exercises are often helpful. Again, this isn't the sexy answer, but like really being present to that person. Also, thinking about, are there things that I'm kind of curious about that I've never really said, or I was too shy or embarrassed? It's like, this is your one life.
Yeah.
What could be one thing? So if you do have that safe and trusting relationship,
Yeah.
use that to your advantage and just think, hey, hon, I've never really said this. Maybe we try it once.
Yeah.
And be that place for your partner too, to kind of go there and risk, because, we get so comfortable because we like security, safety, predictability in many ways. So we get comfortable in what we're doing, but then at the same time, we get uninspired and bored. So you really do have to be creative and risk putting yourself a little bit outside your comfort zone just to see what kind of energy can be created. Because then when you do that, you kind of see yourself as a different person. Like, I didn't think I was that person, who would, I don't know, have sex in the backseat of your car. Or
I was just thinking that. I'm like, can you get arrested if you're having sex on the side of the street? I don't know. Can you in your car?
I think
That would be kind of exciting.
I think you can.
Yeah, I think you. Okay, so
I think you can get like an
You mean like be in the backseat
exposure.
in your
Yeah, so
driveway?
maybe you want to be cautious about that. But the point is,
Well, there was that Modern Family episode where Phil and her, like, she had the fantasy, which I have this fantasy too. She had the fantasy that they just met and they like hooked up, and so
Like met at a bar. And
yeah,
pretended.
so she's in the bar. Yep. And she's wearing like a trench coat, and underneath she's naked, I think. And he shows up, and Phil, he like does something stupid, and kind of ruins it, but not on purpose. Like, he's just so awkward, But I thought it was so cute because they were trying to reenact her fantasy. And I thought that was such a cute idea. I think they did in the end. They went to a hotel room and everything, but I'm like, that's a cute one. Like, you could even say, okay, I'm not who I am. Like, I have a different name. You have a different name. I'm going to be at the bar. I'm going to be wearing this. Like, you approach me and we're going to pretend like we just met. Like, that would be something really fun.
Yeah.
And you already have the hotel.
I've
like,
recommended that to people before because it just shifts up again your sense of your identity and like seeing your partner with new eyes. Like, I'm pretending like I just met you. I can just imagine doing that. Like, oh yeah, I'm going to ask you, like, oh, what are you about? And who are you?
Yeah.
And you're not going to be like, hey, did you pick up the medication yesterday? When you're in the car on the way to a date.
Oh, right.
Yeah.
And you're like, are you serious?
Yeah.
Are we going to do this right now?
Yeah.
That's so true. Yeah, because that could be a buzzkill.
Yeah, I feel like that could be a really easy way to kind of reignite something fun. And it doesn't even have to be a hotel, right? Because you could just go home.
You can just go home, but it's just that energy exchange and that shift in how you are talking and seeing each other when you're out at a bar or somewhere,
Because you're both giving each other like direct attention in a new way instead of just being like, okay, we're on this date. Let's talk about like all this like business type stuff and then have dinner and then we're going to drive home. Yeah. It's more like, oh, so like, what are you doing here? Oh, so what do you do for a living? Like, you're actually like asking each other those cool questions.
Yeah. It gives you that like infatuation feeling that you get when you're first with someone.
And they're showing interest in you.
Yeah.
And vice versa.
The new relationship experience, they call it. And actually...
Lust.
And exactly.
Which we it's hard to get when you know someone for so long.
Oh, I think that's really impossible unless you do some fun things. You have to, you have to plan it.
Yeah.
You have to be realistic that that's just not going to happen. So, you can have those moments, but again, understanding how relationships work.
Yeah.
And if you want lust all the time, you're going to be going through a new relationship like every
Yeah,
day.
I was just going to say that. Like,
Even if that,
I was talking just the other day to my daughter, and she said to me that one of her friends said that in order for this is what her friend, they're young, okay, they're in their like early 20s, and they saw something that said in order for relationships to be successful, the woman needs to feel adored, and the man needs to feel admired. And she was talking to me about it, and we were having this conversation, and I said, yeah, I kind of agree with that. And then she said something about, like, is it adored physically? Because doesn't that kind of die out? And I said, I don't really think it's adored physically. I think it's adored for, like, who they are. Mm-hmm. And I said, I do think that that's true, because, like, they're both getting a good quality, admiration and adoring someone. They're both great qualities. But we had this conversation, and I said, it's like the chemistry, it's not that it's not important, but most of the time you're in a friendship with that person. Mm-hmm. Most of the time, mm-hmm. right? Let's say you're having sex once a week. That's a lot of, let's say it lasts 20, 30 minutes. Let's just be real, 20, 30 minutes, right? The rest of those minutes in that week are spent being their friend, mm-hmm. right?
Yeah.
So you really have to put the focus on that. And of course, the chemistry matters, but I don't think it should be like the number one thing, like, oh, we don't have chemistry anymore, like we're not aligned. It's like, okay, we'll work on the friendship, because that will likely come back, you know?
Yeah.
Yeah.
What you're saying in the beginning of a relationship, don't go so much for the chemistry.
Yeah. Well, and don't like feel like it's, oh, now we're not aligned because I don't like get butterflies when he walks in the room, or he doesn't like compliment my outfit every single day. You know, mm-hmm. I think a lot of women, especially when they're young, again, we're talking to like a, early 20s. I just want her to know that, like, it's not a realistic expectation, and it's okay if there's like a slow burn, I guess.
I guess it depends on the relationship, because we had this conversation in Greece.
Yeah, we did.
And I was like, oh no, you have to have that passion, and that you cannot be without each other, and the lust, and I believe that that's important, that connection, because in my marriage sometimes I'm just like, I have to remember that we had all that, and I remember those feelings, so I get them back, here and there. So if I never had them, I think it would be a lot harder for me.
Well, I don't think you never have them.
I don't think you never.
It's not that you never have them. I just think it's not like the number one attraction, I guess.
Right. But
in the
aren't
beginning.
you usually just attracted to someone at first, and that's what gets you to be...
I don't know. I mean,
right?
I feel like for me...
I don't know.
I feel like for me it was a little different, but...
Oh, yeah. Everyone has...
Yeah. Not to say I wasn't attracted, but like I think at that point in my life, I was like 24, and I had dated a bunch of, guys that, they were nice, but like, I don't know, there was no real... like lifelong thing. And so I feel like I was kind of looking at it differently as I got to a certain age, and I was looking more for like, is this person going to be a good partner? Is he going to be a good husband? Is he going to be a good dad? Is he going to be like someone who I want to spend evenings with?
Yeah.
So I was looking at it differently.
Yeah.
At different stages in our lives. Different stages in our lives, we might be looking for a different kind of partner.
I think you were younger too when you met him.
Yeah.
Right?
Yes,
I was a little bit older, and I had gone through like some relationships that didn't serve me in that way, so I kind of felt like I had to shift gears and start looking for something more like substantial.
I don't think there's a right way. I think it's
no,
just
I
the
don't.
way that happens for you, for each
I
person.
totally don't think there's a right way, because you could meet somebody at a bar. I actually met my husband at a bar, and it could be we were just different ages, I think. So yeah.
But anyway, I think I have rapid fire questions for you. You're like, was that on there?
Yes, it was.
Okay. Yeah, and I would love to ask one of them too. The third one I would love to ask.
Okay, you asked the third one. I'll start with the first. One myth about midlife you'd love to bust.
That it's the end of passion. And it really can be the most creative, passionate time.
Okay.
We step into that.
Yeah, absolutely. I would agree. I would definitely agree with that. The most common phrase you hear from women in therapy.
I feel broken. Yeah.
That's sad.
Yeah.
Oh, that just breaks my heart.
Yeah. And there's other ones, like, also, One did say, I thought it was just me when she started learning. Like, oh, it's not just me. Like, I'm not the only one with these problems, you know? So.
And that's why this podcast is here, because no one is alone. We're all feeling these things. Yeah. I felt broken so many times. Oh my gosh, in the beginning.
Yeah.
Yeah. That's very emotional to hear that, actually.
I know. It's so sad.
Yeah.
Okay, mine is 3. One book or podcast you often recommend.
On the broken theme, there's a book called You Are Not Broken.
Oh, really?
Yeah.
By Kelly Casperson.
I'm reading it.
Yes.
Yep. Mm-hmm.
She hammers that home. And I think we really need to keep on hearing this. Because now that these facts are out about what we're all going through and the possibilities, it's like women need to get this information and education.
Yeah. Absolutely. And she's a big advocate of testosterone for women. Yes. Which can help, and she's got a great podcast, which can help, the testosterone can help with libido.
Absolutely.
But so can estrogen. Yeah. So all of those things need to be addressed, I think. If you're feeling any symptom in perimenopause, all of those can be addressed because it can help you go down the path of great sexual desire in your 40s, 50s, and beyond.
And health.
Yeah.
In a variety of other ways,
too.
So.
Yeah.
Yeah.
Okay, so that was, coffee, tea, or wine for a midlife reset. Or maybe you're not.
Well, can I speak to all 3?
Yeah.
Coffee in the morning. I mean, I need it 1 cup a day. But like wine with girlfriends, maybe at like a nice brunch. Yeah. And then I'd say tea before bed because keep the wine, the alcohol earlier in the day so you can actually sleep. A lot of women's bodies feel like alcohol in the evening, you can't sleep. So have some nice tea.
Yeah. Okay, do you want to do?
If Midlife, I like this one too. If Midlife had a theme song, what would it be?
Yeah, I was thinking about this. One came to mind called Unstoppable by Sia.
Oh, yeah.
I'm unstoppable.
Yeah.
And so, that, this is not the ending and you can persevere. Not only can you persevere, that you can have an amazing, powerful next chapter. Really, it's just about getting your mind to shift from the best was in the past to the best is in the future.
Yeah.
And I can create it and create the life that I love and where I'm thriving.
Yeah. Let's tell people where they can find you. How can they get a hold of you? Do you is it only in person? Like if you're in San Diego, is it virtual? What's the best way to do all that?
So I am only virtual now. So
wow.
And I see clients in a few states that I'm licensed in, Idaho, Vermont, Florida, and California.
Oh, wow.
And I also see clients virtually in Hong Kong. I lived there and still work with folks there. So
wow.
International. And probably the best thing would be to go to my website. It's drzeising.com, and I'll spell that. drzeising.com.
Perfect. And we will also put that in the show notes, how to get a hold of you. Also, you said something about Dipsea.
Yeah.
I'm going to put that in the show notes for the sexy
book.
And side note, too, you said Hong Kong. Do you speak...
Cantonese?
Is that
No, I wish. There's a lot of expatriates there that speak English.
Oh, okay.
So
I was just curious if you had that add on.
Wouldn't that be great?
Yeah.
Nope, just English speaking.
Okay.
Well, nice. Wonderful. Thank you so much for coming.
Yeah,
this
was
great.
So great.
I mean, we could probably go deep on so many other things, and maybe we'll have you back and we can talk.
Focus on something in
sexual
specific.
Health or sexual intimacy or
that would be fantastic.
Like
I'd love it. I love helping your listeners learn something new that they can feel empowered about. So
I know it's what we're here for. We just want them to know what's out there because not everybody knows.
Yeah.
So thank you again. It was a pleasure having you.
It's very nice to have you.